Very recently, actually last week, the FDA approved the first antibody test for COVID-19 as an emergency use authorization, which was granted to Cellex. Serological tests have been called immunity tests because, in theory, a person who recovers from COVID-19 will be immune to the virus. But due to the novelty of SARS-CoV-2, there are several questions that remain, and that is how long immunity will last, and do people who have had mild or no symptoms gain the same protection as somebody who had severe disease? And also, will the virus mutate to overcome the body's immunity? Also, some persons with immunological disorders or defects will not generate the same antibody response in some settings. For the Cellex rapid antibody test for COVID-19, a drop of serum, plasma, or whole blood is placed into a well on a small cartridge, and the results are read 15 to 20 minutes later. And the lines indicate the presence of IgM, IgG, or both antibodies against the SARS-CoV-2 virus. Of 128 samples confirmed positive by reverse transcription PCR in pre-market testing, 120 tested positive by IgG, IgM, or both, and of 250 confirmed negatives, 239 were negative by the rapid test. The numbers translated to a positive percent agreement with RT-PCR of 93.8% and a negative percent agreement of 96.4%, according to the labeling. Results from antibody testing should not be used as the sole basis to diagnose or exclude SARS-CoV-2 infection, according to the label. Negative results do not rule out infection. Antibodies might not have had enough time to form, or the virus could have had a minor amino acid mutation in the epitope recognized by the antibodies screened for in the test. False positives can occur also due to cross-reactivity with antibodies from previous infections, such as from other coronaviruses. Other companies, including LabCorp and Quest, are also developing tests to detect antibodies, although those are intended for hospital and lab use.